Hello, my name is Dr. Andy Franklyn-Miller, one of the consultants in sport and exercise medicine at the Sports Surgery Clinic. Today I'm going to talk to you about back pain, particularly in the lower back. And we know that 60% of us at some point in our lives will suffer pretty bad with back pain, limiting our ability to do the things that we normally want to do. And some people will have recurrent acute spasms of back pain, which really stop them in their tracks. Our understanding of back pain altogether still is far from definitive. We know that you can have some anatomical changes in the back that lead to ongoing causes of pain, but some newer research suggests that a lot of this is pain and pain signs without the direct link to structural changes. Our approach here at the Sports Surgery Clinic has been based on some original research that we published in 2015 with Dr. Welch, and he'll speak to you shortly in terms of those early exercises. But our focus is very much on a strength-based focus of back pain in order to improve the resilience or the capacity of your back to take more load. So if I take you into the anatomy, here we can see the back. If we take away the skin and all of the muscle off this back, we can then zoom in and start to look at the bones, and particularly of the lumbar spine. We can see them here. Each bone itself is made up of a vertebrae. It's made of a big block, and all of the hooks we can see off the side are really muscle attachment points. In the middle of all of this, there's a hole, and through that hole runs the spinal cord. And between each of these bones, when they're in place, out of the side of the gap between the bones here exits a nerve, and those nerves go off to supply various functions in the legs. Between each of the bones there are two joints, a facet joint here and a facet joint there, and that's where the movement of the lower back of the lumbar spine occurs. It can flex and extend and rotate, and these movements occur because of muscle, and we can see that there are a number of muscles as I gradually add the layers of the back. These things are the muscles which extend and rotate, and they're set up in 3 layers, as we can see. And these muscles themselves are the things that help take the pressure off both the facet joints here and also pressure off the discs. And you hear a lot about discs in terms of causes and reasons behind back pain. And if I put the disc in place here, you can see it sits between the 2 bones. But there's still space here where the nerve can exit to run down off the leg. And if the disc bulges or you get some arthritis in the facet joint, you can cause pressure on the nerve, which can give you leg pain, but that doesn't give you back pain, much more commonly coming from the facet joint or the muscle control. And so our approach here is very much to try to improve the musculature of the lower back as step 1. And I'll hand over to Dr. Welch now, who will talk you through that process.
So Dr. Franklyn-Miller was taking you through some of the factors that relate to low back pain there. And the most important message I think to take from his piece is that for the vast majority of you, there's nothing to worry about structurally with your back. And that's an important point because there's a lot of psychology that sits in with low back pain, in particular related to a bit of fear and worry about the structure of your back. He also mentioned that we use strength training as our way of rehabbing people with low back pain. And the reason we do that is twofold. First is to help address that psychology. We feel that if we can increase people's strength and they see a progressive loading of what they're able to achieve in the gym, then that gives them a little bit more confidence around their back. The second reason we do it is to address some of the physiology that sits with this. It's very common to see deconditioning of the muscles in the posterior chain. So we use strength training in order to address that as well. I'm going to talk you through a couple of exercises that we use commonly to help with low back pain. The first being a rack deadlift. Now you might use this at home using a dumbbell as well, but the idea of this exercise is to start loading the posterior chain more and start teaching you to use your hips rather than your back when you move. So you'll see Jack here in the video picking the bar up, and again you might use a dumbbell at home, and he's focusing on making sure he drives the hips backwards as he takes a bow. And the main aim here is that he's feeling the bum and the hamstrings doing a lot of his work. Our 2 main cues are to push the hips backwards and then to squeeze the bum at the top of the lift. That squeezing of the glutes at the top just makes sure that your body knows that you should be using the hips a lot more than the back. And this shouldn't really feel like a very back heavy exercise for you. Again, a good level to reach with this is where you're able to lift 30, 40, 50 kilos. The second exercise is aimed at increasing the strength of your hip extension. So we use an exercise called a hip thrust for this. Now all you need is a chair in order to do it, and Jack's doing this on one leg. And the important points here are to push very slowly through the heel on the ground, and you should feel like the glute with the leg on the ground is the one doing the work. So again, the important points here is that you squeeze the glute hard at the top and lock that hip out, and just to make sure that you feel like the glute is doing the work. And again, you can load this by putting weight on top of your hips. So give those exercises a go at home, have a play around with them. I say the idea of them is not necessarily to be targeting the back, so you shouldn't feel like the back is doing all of the work while you're doing them. Start pushing on some of the loading and try and increase some of the strength at it. But the big messages are to not worry too much about your back, to keep on with your physical activity as you're able, and then to gradually build in a little bit more of these exercises that we've shown you here today to try and speed things along a little bit.